Are you waking up in the middle of the night, bleary-eyed and frustrated, just to run to the bathroom again? If this sounds familiar, you're not alone. Millions of men experience disrupted sleep because of frequent nighttime urination, a condition known as nocturia. But here's the thing, it's not just an annoyance. It can be a sign that something deeper is going on in your body, sometimes minor, sometimes serious. In this video, we'll break down what's normal, what's not, why it happens, and what you can do about it. And before we dive in, if you want more evidence-based tips to improve your health, hit subscribe and give this video a like. You won't want to miss the insights coming next. Nocturia is defined as waking one or more times during the main sleep period to urinate. For younger men, waking once per night may be within the normal range. But if you find yourself getting up 2, 3, or even 4 times, that's when nocturia starts impacting your quality of life. Sleep disruptions from frequent urination aren't just minor inconveniences. They can interfere with your deep, restorative sleep, leaving you tired, irritable, and less able to focus during the day. Studies show that chronic sleep disruption can increase risks for heart disease, diabetes, and even cognitive decline over time. This means nocturia isn't something to ignore, even if it seems harmless at first. Several factors contribute to nocturia, often working together. One major reason is age-related hormonal changes. Vasopressin is a hormone that signals your kidneys to produce less urine during the night. As men age, vasopressin production declines, causing the bladder to fill faster and waking you up. This effect is gradual but persistent, which is why nocturia becomes more common as men get older. Research has shown that altered vasopressin release is one of the main physiological mechanisms driving nocturia in men over 50. Another critical factor is the prostate. Benign prostatic hyperplasia, or BPH, is a common condition where the prostate enlarges with age. An enlarged prostate can partially block the urethra, causing residual urine to remain in the bladder. That residual urine triggers a sensation of needing to void more frequently. Even small amounts of residual urine can make the bladder signal the brain that it's full, leading to multiple awakenings during the night. In fact, studies indicate that up to 50% of men over 60 experience BPH-related urinary symptoms, and nocturia is often the most disruptive symptom. Medical conditions can further exacerbate nocturia. Diabetes, for example, can increase urine output due to high blood sugar levels, a phenomenon known as osmotic diuresis. Men with heart failure may experience fluid accumulation in the legs during the day, which returns to circulation at night when lying down, increasing nighttime urine production. Kidney disease can reduce the kidney's ability to concentrate urine at night, leading to frequent trips to the bathroom. Sleep apnea also plays a role by altering the normal nighttime release of antidiuretic hormone, increasing urine production. Even medications like diuretics, commonly prescribed for high blood pressure or fluid retention, can contribute to nocturia if taken later in the day. Lifestyle factors often amplify these medical causes. Caffeine and alcohol are both diuretics, and consuming them in the evening can increase nighttime urination. Drinking large amounts of fluid right before bed, whether it's water, juice, or other beverages, naturally increases the need to void. In addition, poor sleep hygiene, irregular sleep schedules, excessive screen time before bed, or an uncomfortable sleep environment can make bladder sensations more noticeable and disrupt your perception of nighttime urgency. So, what counts as normal? One trip to the bathroom per night can be within the normal range, particularly for men under 50. However, studies suggest that waking 2 or more times per night is associated with clinically significant nocturia and warrants evaluation. A population-based study published in BGU International found that about 30% of men under 50 experience nocturia, usually just once per night, without serious health consequences. Beyond the number of trips, the impact on sleep and daytime function is equally important. If even one trip is interrupting deep sleep and causing fatigue, it should not be ignored. Addressing nocturia involves understanding its multifactorial nature and targeting the root causes. Behavioral strategies are often the first step. Limiting fluid intake in the evening, avoiding caffeine and alcohol late in the day, elevating the legs before bed if swelling is present, and improving sleep hygiene can all reduce nighttime urination. These lifestyle changes are simple but effective and can reduce the number of trips significantly when combined with medical management. Medical interventions may be necessary when behavioral strategies are insufficient. BPH is a common contributor to nocturia in older men. Medications such as alpha blockers and 5-alpha reductase inhibitors can improve urinary flow and reduce nocturia by addressing obstruction in the urethra. In cases where low vasopressin production is a primary factor, desmopressin, a synthetic analog, can reduce nighttime urine output. However, desmopressin carries the risk of low sodium levels, so careful monitoring is essential. Overactive bladder symptoms may also require medications like antimuscarinics or beta-3 agonists, but side effects, especially in older adults, must be considered. It's crucial to recognize when nocturia signals a more serious problem. Warning signs include blood in the urine, sudden worsening of symptoms, pain, fever, or inability to urinate. These could indicate urinary tract infections, kidney stones, or, in rare cases, malignancy. Ignoring these symptoms can lead to serious health complications. Timely evaluation ensures that treatable conditions are addressed early, improving both nighttime sleep and long-term health outcomes. Nocturia also affects quality of life beyond sleep. Repeated nighttime awakenings reduce the amount of deep restorative sleep, leading to daytime fatigue, poor concentration, irritability, and impaired immunity. Chronic sleep disruption has been linked to higher rates of cardiovascular disease, diabetes, and cognitive decline. Addressing nocturia is therefore not just about comfort, it's a critical component of overall health. Scientific research supports these insights. A study in sleep found that up to 70% of older adults report nocturia, and it is strongly correlated with poor sleep quality and daytime complaints. Another review in European Urology emphasized that nocturia is often multifactorial, requiring a combination of lifestyle, behavioral, and medical interventions for effective management. These findings highlight that while nocturia is common, it should not be ignored, as effective interventions exist. Practical strategies include tracking fluid intake and timing, monitoring caffeine and alcohol consumption, managing underlying medical conditions such as diabetes, heart failure, and kidney disease, and seeking evaluation for sleep disorders. In many cases, combining behavioral changes with targeted medical treatment leads to the best outcomes, reducing nighttime trips, improving sleep quality, and enhancing overall health. In summary, nocturia is a common but often overlooked issue that can impact both sleep and long-term health. Understanding the causes, recognizing warning signs, and taking proactive steps, both behavioral and medical, can restore restorative sleep and improve quality of life. In conclusion, waking up once per night can be normal, but recurrent nocturia deserves attention. It may be a minor inconvenience or a sign of a deeper health issue. By paying attention to your body, adjusting lifestyle factors, and seeking professional evaluation when necessary, you can improve both your sleep and long-term health. Don't let nighttime bathroom trips steal your energy and focus. If this video helped you understand nocturia better, make sure to subscribe and hit the like button. Better nights lead to better days, and being informed is the first step to taking control.